Look in the mirror right now. Not your whole face, just your jawline, your neck, the area under your chin. Do you notice something pulling, something drooping, something that wasn't there 10 years ago, or even 5? Most people blame aging. They blame gravity. They buy expensive creams. Some even consider surgery. But here's what almost no doctor tells you at your annual checkup. And honestly, it might change everything you thought you knew about aging. The sagging you see in your face may not be coming from your face at all. It's coming from your spine, specifically your neck. And the most shocking part? There is a simple 1-minute exercise that thousands of people over 60 are doing every single day. That is physically lifting their face without a single needle, without surgery, and without spending thousands of dollars. Breath, stay with me, because in the next few minutes, I'm going to explain exactly why this happens, who it affects most, and how you can start doing this exercise today. Hello, and welcome back. If you're new here, welcome. This channel is dedicated entirely to the health, wellness, and quality of life of people over 60. Because you deserve real information explained clearly with the respect you've earned. Today we're talking about something that millions of seniors are experiencing, but almost no one talks about openly: facial sagging. Now, I know what you might be thinking. Is this really a health issue, or is this just vanity? And I want to be completely honest with you. This is a health issue. Here's why. When your neck and spine are not properly aligned, it doesn't just affect how you look. It affects how you feel. It can cause chronic neck pain, headaches, jaw tension, difficulty swallowing, poor posture, fatigue, and even disrupted sleep. The visible sagging you see in the mirror, the jowls, the loose skin under the chin, what some people call the turkey neck, that's often one of the first outward signs that your cervical spine, the part of your spine running through your neck, is under stress. Breath. So today, we're going to cover 4 things. Why your spine directly affects how your face looks and feels. The postural habit that's aging you faster than almost anything else. The exact 1-minute exercise that targets this problem at its root. And what else you can do, starting today, to turn things around. Let's get into it. To understand this, I need to give you a quick, simple anatomy lesson. Don't worry, no medical degree required. Picture your spine as a tall tower of building blocks stacked perfectly on top of each other. When those blocks are aligned, the whole structure stands tall, balanced, and strong. Now, your skull, your head, sits right on top of that tower. And your head is heavy. The average human head weighs between 10 and 12 pounds. That's roughly the weight of a bowling ball. When your spine is in proper alignment, your head balances perfectly over your shoulders. Your muscles don't have to work very hard to hold it up. Everything is efficient, supported, and relaxed. But here's where things go wrong for so many people over 60. Over time, and this is so important, most of us develop what experts call forward head posture. Think about your daily habits. Do you look down at a phone? Lean forward at a computer? Sit in a recliner with your chin jutting out? Sleep on a pillow that pushes your head forward? Every single one of these habits, done day after day, year after year, slowly trains your cervical spine to shift forward, out of its natural position. Breath. And here's what that does to your face. When your head moves even 1 inch forward from its ideal position, the effective weight your neck muscles carry increases by about 10 pounds. 2 inches forward? That's 20 extra pounds of pressure on your cervical spine. Your muscles at the front of your neck become overstretched. The muscles at the back become overworked and tight. The connective tissue, the fascia, that runs from your neck all the way up and over your face begins to pull downward. Imagine pulling the bottom of a sock downward. The top of the sock sags. Your face works the same way. The platysma muscle, a thin, flat muscle that runs from your chest, up your neck, and connects into the lower portion of your face, begins to droop when the neck is chronically misaligned. your jawline softens. The area under your chin loses its definition. The corners of your mouth pull slightly down. This is not just gravity aging you. This is your posture aging you. And the incredible thing is, it can be addressed. Now let me ask you something. Do any of these sound familiar? You wake up in the morning with a stiff neck or tightness across your shoulders. You get headaches at the base of your skull, the kind that feel like they're coming from the back of your head. You find yourself needing to crack your neck. Or maybe you've noticed your chin seems to be moving forward and down, and your upper back has developed that slight curve, sometimes called a dowager's hump. If you nodded yes to even one of those, you're not alone. And more importantly, you're in the right place. Many seniors are told these are just normal signs of aging. And while some changes are natural, the extent to which poor neck alignment accelerates facial aging is massively underestimated. Breath. The people most at risk include those who spent careers at a desk or computer. Decades of leaning forward toward a screen, even slightly, creates deeply ingrained postural patterns that don't disappear when you retire. Women, particularly after menopause, are also at higher risk. Hormonal changes reduce collagen and muscle tone, making the effects of neck misalignment even more visible on the face and neck. People who sleep on their stomachs or with multiple thick pillows are also affected. Your sleeping posture matters enormously. If your neck is pushed forward or cranked to one side for 8 hours every night, that adds up over years. And anyone who has experienced whiplash, a neck injury, or cervical arthritis, these conditions change the natural curve of the cervical spine and accelerate the drooping effect. Breath. If you're over 60 or caring for an elderly loved one, this information could genuinely be life-changing. Because once you understand the connection, you can actually do something about it. And that something is a lot simpler than you think. All right, this is what you've been waiting for, the 1-minute exercise. Now, before I walk you through this, I want to say something important. Please talk to your doctor before beginning any new exercise routine, especially if you have existing neck issues, spinal stenosis, severe arthritis, or have had any neck surgeries. The exercise I'm about to describe is gentle and appropriate for most people, but your individual health always comes first. If anything causes pain, stop immediately. Breath. That said, this movement is based on a well-established physical therapy technique known as the cervical retraction exercise, sometimes called the chin tuck. Physical therapists have used this technique for decades to correct forward head posture, relieve neck tension, and retrain the deep, stabilizing muscles of the cervical spine. Here's how to do it. Step 1. Get into position. Sit upright in a firm chair, with your feet flat on the floor. Sit slightly toward the front edge of the seat. Your back should be straight, but not rigid. Relax your shoulders, pull them gently back and down, away from your ears. Take one slow, deep breath. Let your jaw relax. Let your face soften. Step 2. Find the movement. Now, without moving your shoulders and without tilting your head up or down, gently draw your head straight back. Think of it this way. Imagine someone has attached a string to the back of your skull and is gently pulling it backward and slightly upward. Your chin will naturally tuck in a little, not dramatically, not forced, just a gentle, controlled retraction. You should feel a mild stretch along the back of your neck and possibly at the base of your skull. That's exactly right. That's the tension releasing. Hold that position for 3 to 5 seconds, then gently return to neutral. Not forward, just neutral. Step 3. Repeat. Do this movement 10 times. Slowly. Controlled. The entire sequence takes about 60 seconds. That's it. Breath. 10. Gentle retractions. 1 minute. Do this once in the morning and once in the evening, and over time, you will begin to re-educate the muscles of your cervical spine to support your head in a more upright position. Now, why does this affect the face? When you consistently practice this movement, several things happen. The deep cervical flexor muscles, the ones responsible for holding your head in proper alignment, gradually strengthen. As your head moves back over your shoulders where it belongs, the fascial tissue along the front of your neck stops being chronically stretched downward. The platysma muscle regains its tone. The jawline begins to look more defined. The underchin area tightens naturally. Will it be as dramatic as a facelift? No. But we're not trying to turn back 40 years in a week. What thousands of people report after 4 to 8 weeks of consistent practice is real. A more defined jawline, reduced neck tension, improved posture, fewer headaches, better sleep, and yes, noticeably less sagging in the lower face and neck. And here's the beautiful part. It costs nothing. It requires no equipment. It takes 60 seconds. The exercise is the foundation. But there are several other habits that will significantly speed up your results and protect your neck and face health long term. Habit number 1, check your screen height. Whether it's your phone, your television, or your computer, raise it up. Your screen should be at eye level, so your head stays neutral, not dropping forward and down. A simple phone stand or laptop riser can make a remarkable difference over time. Habit number 2, re-examine your sleep setup. Your pillow should support the natural curve of your neck, not prop your head forward. If you sleep on your side, your pillow should fill the gap between your ear and your shoulder. If you sleep on your back, a medium firm pillow with a slight cervical roll is often ideal. Stomach sleeping should be avoided if possible. It places significant strain on the neck throughout the night. Habit number 3, hydrate consistently. The discs between your cervical vertebrae are largely made of water. When you're dehydrated, and many seniors are chronically mildly dehydrated without realizing it, those discs compress more easily, contributing to the flattening of the cervical curve. Aim for 6 to 8 glasses of water daily. It sounds simple, because it is. And it matters more than most people realize. Habit number 4, warm up before the exercise. Before doing your chin tucks, spend 30 seconds doing very slow, gentle neck rotations. Turn your head left and right, then tilt ear to shoulder on each side. This warms up the tissue and makes the retraction exercise more effective and comfortable. And habit number 5, build in posture checks throughout your day. Set a gentle alarm on your phone every hour. When it goes off, take a breath, roll your shoulders back, and check your head position. Are you forward? Gently retract. This simple habit, done consistently over weeks, works alongside the formal exercise to reinforce good alignment all day long. Before we wrap up, there are some signs that go beyond posture and aging. Signs that mean you should see your doctor as soon as possible, rather than waiting. Please listen carefully. If you experience numbness or tingling in your arms or hands, this can indicate that a cervical vertebra or disc is pressing on a nerve. This is different from normal muscle tightness and needs professional evaluation. If you experience dizziness when you move your head, this can sometimes be related to cervical spine issues, but it can also indicate other conditions that need to be ruled out. If you have a sudden worsening of neck pain after a fall or an accident, do not stretch or exercise. See a doctor first. If you notice difficulty swallowing, that seems to be getting worse. A progressive symptom like this always needs medical attention. And if you have severe headaches that are new or feel different from your usual headaches, the cervical spine can refer pain to the head. But new or unusual headaches should always be evaluated. Breath. Please don't ignore these signs. Gentle exercise is wonderful for general neck health and posture, but it is not a substitute for medical care when these kinds of symptoms are present. Your health comes first. Always. Let's bring everything together. Your face doesn't sag simply because you're getting older. Yes, some changes come with time, but a huge contributing factor that almost no one discusses is the alignment of your cervical spine and the health of your neck muscles. Forward head posture, That subtle but powerful shift of your head in front of your shoulders creates a downward pull on the fascial tissue and muscles connected to your face. Over years, this pull becomes visible. The jawline softens. The neck loses its tone. The lower face droops. The 1-minute chin tuck exercise works by strengthening the deep muscles of your neck, correcting your head's position over your spine, and releasing the chronic downward tension that contributes to facial sagging. It is not magic. It requires consistency, but it is real. It is supported by decades of physical therapy research, and it is available to you, right now, today, for free. Breath. I want to leave you with this thought. You have lived a remarkable life. Your face has smiled, cried, laughed, worried, and loved for 6, 7, 8 decades. The changes you see in the mirror are evidence of a life fully lived, but that doesn't mean you have to feel uncomfortable or in pain or resigned. Small, consistent actions, like 60 seconds of gentle exercise, each morning and each evening, compound over time into real, meaningful change. You are not too old to feel better. You are not too old to look more like yourself. You deserve to feel good, in your body, at every age. Start today. Just once today. 10 chin tucks. 60 seconds. And come back here tomorrow. We'll be with you, every step of the way. If this video helped you, or if you think it could help someone you love, please share it right now. Send it to a friend, a sibling, a parent, a spouse. The information is free, and it just might change how they feel about what they see in the mirror. If you're new here, please subscribe and hit that notification bell. Every week, we bring you clear, trustworthy health information designed specifically for people over 60. No fluff, no fear-mongering, just honest guidance you can actually use. And I'd love to hear from you in the comments below. Have you ever noticed a connection between your posture and how you look or feel? Have you tried chin tucks before? What did you notice? Your comments don't just help me, they help the thousands of people in this community who read them and realize they're not alone. Take care of yourself. Take care of each other. I'll see you in the next video.